So my name is Gareth Clegg. I'm one of the doctors here in the emergency department in Edinburgh's Royal Infirmary, and I've worked in emergency medicine for probably the last 20 years. I spend some of my time here seeing patients and some of my time doing research into out-of-hospital cardiac arrest. I have a team called the Resuscitation Research Group, a part of the University of Edinburgh. So the difference between cardiac arrest and heart attack. Well, a heart attack is quite a common occurrence, but it's very different to a cardiac arrest. So with a heart attack, one of the arteries that supplies blood to the heart can get blocked, sometimes by a small blood clot, and that causes pain in the muscle of the heart, which people feel in the chest, sometimes in the arms, sometimes in the neck, can sometimes feel like bad indigestion. And a heart attack is a medical emergency. You need to get to hospital to have that blockage unblocked as soon as possible to reduce the chances of damage to the heart. But a person who's having a heart attack is generally awake. They might be quite sore and sweaty and uncomfortable, but generally they can talk and they can breathe and they're okay. A cardiac arrest is a very different thing. Some people think it's like the American term for heart attack, but actually it's a completely different condition. And in a cardiac arrest, the heart stops pumping blood completely. There's no blood getting to the brain, there's no blood getting to the rest of the body. And with a cardiac arrest, I often think it's the poster child of medical emergencies because it happens very suddenly, it can happen to anyone at any time, and actually in order to save a life when someone's had a cardiac arrest, you have to act really, really quickly. For every minute that nobody does anything while someone has a cardiac arrest, their chance of survival drops by 10%. So with a cardiac arrest, often what's happened is there's an electrical storm around the heart. The normal electrical impulses that send instructions to the heart to beat have stopped and become very abnormal. And what's required is an electric shock or a defibrillation in order to restart those electrical signals and allow the heart to beat properly.